Good morning, ladies and gentlemen. Good morning, the African brothers and sisters. This is an immense pleasure to stand right here. We have with us right here Dr. Chander, who is the head of the GI department. He's going to give more details about that. And we are right here at Shardakare Health City, which is one of the top medical facility available in Delhi NCR. We need to ask doctor a couple of questions, and we believe that the answer he's going to give is going to be very informative for you who is watching right now. Good morning, dear doctor.
Good morning. I'm Dr. Jagdish Chander. I'm
Correct.
senior director and head of department of GI surgery. Basically, it is the Advanced Laparoscopic Surgery, Bariatric Surgery, and General Surgery department at
Okay.
this hospital. Prior to joining this hospital, I've been working in the three topmost institutions of Northern India. That is All Institute of Medical Sciences, New Delhi,
All right.
Maulana Azad Medical College, New Delhi, and PGI Chandigarh. And
All
these
right.
are the three topmost institutions. In 2014, I took a voluntary retirement from government service and joined the private sector. And for 7 years, I was head of department of laparoscopic surgery at JP Hospital, Noida.
All right.
Subsequently, I was heading the department at Fortis Hospital. Now, recently, I have joined Sharda Healthcare City
All right. Good.
Hospital. Now, basically, our forte is entire GI surgery, but I want to emphasize that GI surgery, almost all the GI surgery, we do it laparoscopic surgery. I think you must have heard of this aspect of surgery, in which we do the entire surgery by making just a few holes.
Oh,
And this
wonderful.
and this is also called a keyhole surgery. And in fact, size of holes we make it's of a keyhole size.
Got it. Got
These
it.
are very small. And what is the advantage? And its advantage is that the post-operative pain is very little. And most of the time, patient is up and about in 3 or 4 hours. Patient started taking feeds on the same day, and most of the time it is discharged. Now, in cases of advanced laparoscopic surgery, where earlier for a cancer or other GI surgery, when the large incisions used to be given, patient used to be bedridden for a long time.
Okay.
Not only the pain, it is a loss of activity, but a loss of earning also.
Okay.
Now, with this type of surgery, keyhole surgery, I think there are many, many advantages.
What are the advantages?
Yeah, advantages I've already revealed. That pain is less.
Yeah, less pain.
Recovery
and
is
fast
fast.
recovery.
Discharge from hospital is fast.
As soon as
Fast.
possible.
And then patient starts early, quite early.
Good.
Most of the time, patient, and then of course cosmetic results. Particularly.
No scar.
No scar. Virtually no scar. We are very particular about young girls who are unmarried.
Yeah.
They
got
should
it.
have. They should have. Shouldn't have a problem in the marriage market.
Got it.
So I'm very particular about a young unmarried girl when a poor parents
Oh,
that
good.
they should not have any scar in the body.
That's
And
wonderful.
that is a big social
That's wonderful.
advantage. Now, people should feel rest assured that what is the scope of laparoscopic surgery
Very
in
important.
India,
Correct. Correct.
particularly in this hospital. Now, I mean, it's a matter of pride that we started this surgery with the in the same era when it was developing in America and the rest of the Western world.
Okay.
That was early 90s. And I belong to the first batch of surgeons in India who started laparoscopic surgery.
And how long has it been in existence? This
I mean, history is not much. This came in early 90s.
early 90s.
Early 90s.
But in India.
Yeah, India also.
All right.
Virtually almost at the same time when it came to America, maybe a few months or few years later. So early 90s, we started this thing in India. At the time, of course, there was a problem because you had to learn the surgery on your own, right? There was no teacher.
Okay.
And since we were the professors in the medical college, we had to learn and teach others.
Wow.
And we can
Awesome.
we can
Awesome.
proudly say that in India, the biggest advantage was by 90s, technologically, India was advancing fast, and we had all the sophisticated equipments available, plus the amount of the material available, and we should not call patients as the material, the type of patients available. We could learn these things very fast and advance very fast. And whereas the rest of world for a very years was confined to what is called as a basic laparoscopic surgery. Now, basic laparoscopic surgery is generally 3 or 4 surgeries. Those for removal of gallbladder, there's for removal of appendix, and repair of hernia. These come under the heading of basic laparoscopic surgery.
Okay.
Anything beyond that is called advanced
Advanced
laparoscopic
For instance?
surgery. Yeah. It could be anything.
Could
you know,
be
when we
anything.
say GI surgery, it could be food pipe, it could be stomach, it could be duodenum, it could be small intestine, large intestine, pancreas, liver, spleen.
Those are under advanced
Yeah,
category.
and
All
of
right.
course the kidney surgery.
And kidney surgery. All
right?
right. All right.
Now, we mastered this quite fast. You know, by 1995, we were doing more than, by 96, we were doing more than a basics.
All right.
And as on today, we have a very large experience of doing
Very
these
large
surgeries.
experience. That's
And
wonderful.
my personal experience is that more of 40,000 surgeries.
Wow.
Yeah.
And what are the most complicated cases that you dealt with during
Yes.
your medical journey? And
I think there are many.
there are many.
Many.
All
you
right.
know. So one of the first thing I would like to mention is that surgery of common bile duct. You know, the gallbladder surgery is common.
Okay.
But gallbladder opens into one duct called as a common bile duct. Now, surgeons are literally scared of doing any surgery on common bile duct.
Okay.
I'm the first person in India to start this surgery, and my published series.
Wonderful.
Published series is one of the biggest in the world. It is biggest in Asia when published, and it is among the first major 5 series published in the world literature.
Wonderful.
And our clearance rate is almost 100%, and that is because of local technique developed by me, which is called a rigid choledocoscopy. All over the world, rigid choledocoscopy, people have no sort of experience of this thing. But I started it, I developed it, and that is basically the reason why we have got a 100% result. But elsewhere in the world, when they have a clearance rate of 90%, they feel very happy. Between 90 and almost 100,
yeah, it's
there's
almost
a big gap.
Yeah.
Big gap. That is the number one. Second thing is, another one procedure for vascular problems. There's called problems. We do a sympathectomy, behind the back. In the back, there is something called a sympathetic chain.
It's a kind of pipe or something?
No, it's not a pipe. These are nerves, chain of nerves.
Okay.
This laparoscopic sympathectomy was first described by me.
All right.
Me in the world literature, and in the books also. They give credit to it for this thing. Now, there was a type of disease in India, particularly in developing countries, which is used to be called a Burgess disease, or some related disease to that, where we don't directly operate on the vessels. We do something so that they open up. That is called sympathectomy.
Okay.
Yeah, that is number one.
Awesome.
Third thing is one more surgery done on a common bile duct, which I mentioned earlier. That is called the choledochoduodenoscopy. It's a very tongue twisting thing.
Okay.
That is very complicated surgery.
Right.
When we bypass that duct.
All right.
Because of lower down the problem is so much, we create a new channel between intestine and the duct. That is called
create a new channel.
New channel. That's right.
Okay.
Because see, sometimes a lot of stones, get held up here for a long time. These are stenosed, channel is narrow. So we have to create a new channel. Again, that series published by me long back in early 2000 was biggest in the world.
All right.
And which still remain biggest in the world. Because at least in this part of the world, there's nobody other person doing that sort of surgery.
Got it.
So similarly, we can relate an n number of instances where we use the laparoscopy. I'm talking about laparoscopy only, and one of them is called as a pancreatic necrosectomy. Now, pancreatic surgery is quite a difficult surgery. When patient develop a pancreatitis, sometimes it undergoes a necrosis. Whole thing becomes necrosed.
All right.
Now, to remove that necrosed thing, that thing, is almost hell of a job, even in open surgery. But to do it laparoscopy is
it's easier.
It's very difficult. Very difficult. So we mastered even this thing to do a pancreatic necrosectomy laparoscopically. That produced a very good results.
Is that a computer-based surgery? You were looking from a screen or something?
Yeah. The problem with laparoscopic surgery is that you are looking at a screen in front of you and operating down below, and all the things are a reverse of what you do in a normal surgery.
Wow.
Like you have got a normal surgery, you have got an instrument which may be 6 inches long, 9 inches long, at the most 11, 12 inches. Here you have a long instruments which are minimum length is 36 centimeters.
Yeah.
Some of them have got a 44 centimeters. And you are looking there and operating down below,
Wonderful.
right?
Wonderful.
And the thing is, the movement is such, if you move the instrument downwards, in the screen it moves upwards. And that is why it is very difficult. Because what happens is that in normal surgery, you get a visual feedback,
Yeah.
you get a tactile feedback. You can feel it.
You can feel it.
Now here you can't feel it.
Yeah.
And you don't have a depth perception. Unless you are doing it robotically, in normal laparoscopy, you don't have a depth perception.
Got it.
So only thing you see is the length and breadth. You don't know the depth. So inside your brain, there is something called a spatial orientation, spatial, S-P-A-T-I-L, spatial orientation. You have to create a vision inside your brain, a lot of processing going on, and then from there you get a depth perception.
Awesome.
And that is why laparoscopic surgery is very difficult, particularly advanced laparoscopy.
Good.
So there, the most difficult part is to do a suturing, suture it.
Yeah.
It's a hell of a job. So Americans I'm sorry to say, Americans were not good at suturing.
Okay.
So that is why they created a robot.
Okay.
Something which takes 10 years for a normal person, with the robot, it takes only half an hour to learn. So robot,
Yeah.
it's intuitive. With robot, you learn everything in half an hour.
Yeah.
Whereas the same thing, if you do laparoscopy, it may take years and years. Because the knotting, taking sutures is a very difficult job.
Yeah, got it.
So I think what we want to convey is that when you are operating, you have some pathology inside your tummy related to any GI tract. This can be done laparoscopically as on today.
Wow.
Whether it is cancer or a non-cancer.
Wow.
Everything can be done.
Everything can be done.
And all these advantages can be transferred to the patient.
Wonderful.
Yeah.
Wonderful.
Yeah.
So wonderful that we have you.
There's no, to simplify, there is no organ inside the tummy which cannot be treated by laparoscopy. In
no organ.
Major hospital, including this hospital.
This is wonderful.
Yeah, it's wonderful.
This is wonderful. This is wonderful.
And
we believe that this is going to be very informative for the people that are watching us.
Right.
And then we hope to meet you very soon with a lot of people watching us, very curious.
Sure.
And definitely they will want to meet you for this. And we thank you so much for your time, for watching this video.
Only
you want to add something?
I want to add one sentence.
Yeah.
And before joining this private sector, I was a professor in medical college.
You were a professor?
So, yeah, I was professor in all the three big institutions. And there we trained a lot of doctors in laparoscopic surgery. And I would like to mention here the person who operated on Queen Elizabeth. Queen Elizabeth is dead now.
She already passed.
That boy was trained by me.
Oh.
Yeah, he was trained by me. So, in the Delhi NCR, most of the young doctors who are doing laparoscopic surgery, and they are being trained by me.
Wow.
Yeah. So it was a very satisfying, not only doing it yourself, but disseminating this knowledge, not only in India, a large number of these people are working abroad.
Yeah, they have traveled abroad.
And they are doing very well.
That's
very
wonderful.
Well. And I have treated hundreds and hundreds of doctors in the art of laparoscopic surgery.
This is wonderful.
Yeah.
This is wonderful.
Thank you.
We really thank you for all this information. We hope that our viewers, they will be able to understand.
Right.
And then
Can I add one more sentence?
Yeah, sure.
This laparoscopy includes bariatric surgery also for overweight.
Okay.
For obesity. So obesity can be treated completely with the long-lasting efforts, lasting for entire life, by what is called as the bariatric surgery. And bariatric surgery is also done laparoscopically, which is done here also.
Wow.
Yeah.
That's great.
Dr. mentioned about.
He has mentioned about that.
Obesity. That we can reduce that one.
All right. Thank you so much. Thank you so much for your time. This is a wonderful experience, including for me. I'm learning a lot.
I hope
and then we hope that our viewers also they have learned a lot from everything that you have just mentioned. It was very educative. And then we hope to see you very soon.
Thank you.
Thank you so much.
Thank you very much. Thank you.